It's just been one of those days. First, I want to open the budget recommendations for Department of Children and Families, and just temporarily. And so with that, the meeting is open for the Department of Children and Families recommendation. Representative Clifford.
Mr. Chairman, thank you, Mr. Chairman. Given the additional information I received, I'd like to withdraw my recommendation for the $1 million enhancement to CALM in the DCF budget.
Very good. Thank you. Is there a second? Second by Representative Reeves. Discussion. I think we kind of had a little bit of a discussion about that. They really don't have a plan for that. They said that they would use it and try to use it, but I'd rather see them come to us with, you know, a plan of what they're going to do with it. So any further discussion?
Just a point of order, yes. They still have the $450,000.
Yes. Oh, yes. That's a separate recommendation.
Thank you, Mr. Chairman.
Very good. So it is in there for $450,000. Further discussion? All in favor say aye.
Aye.
Opposed, same sign. Motion carries. Okay, I'll open up the hearing for the Kansas Department of Aging and Disabilities recommendations. And do I have any recommendations? Representative Ballard.
Thank you, Mr. Chairman. We heard from the community mental health centers about what they have done. We also know that they have services in all 105 counties, 24 hours a day, 7 days a week. And actually, they haven't had a behavioral health rate increase in over a decade. So I'm going to recommend $5 million, and that would be an SGF for community mental health centers. And as you know, all Kansans needing help, regardless of their ability to pay, must be accepted because it is part of our program.
Do I have a second?
I'll second, Mr. Chairman.
Second by Representative Clifford. Discussion? I think you did your discussion in the... I know, I'm just kidding. Okay. Any further discussion, committee? Any questions? Seeing none, all in favor say aye. Aye. Opposed, same sign. Motion carries. Do I have any further recommendations for Department of Kansas? Representative Reeves.
Just kind of staying along with the community mental health centers. There's those community mental health centers that are already going to implement the CCBHC, and they have been recipients of some awards that grants that they use in order to begin to implement the CCBHC. But there are 12 community mental health centers that don't have that yet, and so we support them. The Association of Community Mental Health Centers of Kansas, $4.8 million CCBHC implementation mini grants proposal to the Spark Advisory Panel.
Very good. Do I have a second? Second by Representative Ballard. Discussion?
Representative Thank you. Yeah, I was on WebEx last week, and you heard Lisa Southern from Compass Mental Health discuss this. We were one of the 5 community mental health centers that did receive the mini grants, and it was instrumental in helping us make this transition to the CCBHC model. So I'd certainly be in favor of this.
Very good. Committee, further discussion? Seeing none, all in favor say aye.
Aye.
Opposed, same sign. Motion carries. Further recommendations? Representative Howerton.
Thank you, Mr. Chair. So I just want to make a note that the committee supports the Association of the CMHCs of Kansas's capacity building initiatives proposal to the Spark Advisory Panel.
Do I have a second? Representative Reeves, seconds. Discussion. Well, I think this goes along with the ask that they had asked when we heard testimony. Same thing. So we're just weighing in. If there's any weight in this committee at all, we're weighing in on it. So very good. All in favor, say aye.
Aye.
Opposed, same sign. Motion carries. Committee, other recommendations? Representative Vaughn.
Thank you, Mr. Chair. When we heard from testimony last week, something that really stuck out was the need in our IDD community to comprehensively do more to support both provider rates and looking at decreasing the wait list in the long term, and just realizing that it's a really multifaceted issue. But to get started on addressing it, I think it's really important that we look at increasing provider rates for this waiver under the HCBS IDD waiver. So with that, I would recommend that we add $68.4 million with $27.4 million SGF, which is about half of what was requested, to provide a 14% increase to reimbursement rates for providers of home and community-based services for the intellectual and developmental disability waiver services for fiscal year 2023.
Do I have a second? Second by Representative Ballard. Discussion. Representative Clifford.
And I have a question. Mark Hine from SGSI in Finney County testified to this committee on behalf of CDDOs. And I'm wondering if any of this money goes to the CDDOs who haven't had an increase for quite a while. I think they had a $2.5 million ask for CDDO administration. I mean, these are the folks determining the eligibility, but is this included in this
It is not.
enhancement?
This is just directly to the providers.
Is there an ask on their behalf as well, or?
No, but you're more than welcome to make that ask.
Yeah, I would like to make that ask on behalf of the CDDOs of a $2.5 million increase for CDDO administration.
Okay, who was the second on that? Okay. Is that okay with the second? Okay. Further discussion? Well, I think, you'd have to be living under a rock to not realize how hard and our ID and DD folks have been affected by this pandemic. And I think they're on life support, and I think this committee needs to do, I know their ask was $50 million, SGF, and this is a little less than half of that. It's still a lot of money, and we're not the only ones that gets to weigh in on this process. This will be in the Senate side also, and we'll have to get it through appropriations. And although I'd like to ask for more, I think there's a lot of things I'd like to ask for more on, but I think this is doable. Representative Ballard.
I would concur with that. We know how hard they work. We also know that they don't see much money. We also know that they're short of help and they're having to work longer hours than they normally would have to work. And if you're going to give it directly to the providers, I think you need to make sure you're covering the people also that are on the top. So I really appreciate that amendment.
And I think Matt wants to clarify that there's already 2% in the governor's budget.
Actually, Mr. Chair, you are correct. There is the 2%, but I wanted to clarify the motions. I think Representative Vaughn had made the motion for the provider rate, but I wanted to make sure because Representative Clifford brought up the CDDO separate, and I wanted to see if.
Real quick, hold your, okay. We're on the first motion now. Further discussion on motion number 1, which was add 68 million, all funds, 27.4 million SGF. Any more discussion on that? Yeah, he's going to make it in a separate motion, which is probably very, these guys are supposed to keep us out of trouble, and they do a good job of that, so. Right. So that's all it is. Yeah, sir. Further discussion. Oh, just in the governor's budget for all waivers, the 7 waivers, there is a 2% increase. So technically this would be a 16% increase for the IDD folks. Further discussion. All in favor say aye. Opposed, same sign. Motion carries. Representative Clifford.
Chairman, I'd like to move to enhance the budget for CDDO by 2.5 million for CDDO administration.
Very good. I have a motion. Second by Representative Ballard. Discussion. I think we all know they came in and asked for it. They haven't had a raise for, what, 7 years or something like
I thought
that?
it was 10, but it's been a
10?
while.
Okay.
It's overdue.
Been a while. So, very good. All in favor, say aye.
Aye.
Opposed, same sign. Motion carries. Further recommendation. Representative Helmer.
I note the committee's support for Midland Care's PACE expansion proposal to the Spark Advisory Panel.
I have a motion. Do I have a second? Second by Representative Ballard. Discussion.
Sorry, Mr. Chairman, can you clarify what this was? Sorry.
Was this PACE?
Yes, sir.
Okay. We've,
I got it. No, PACE. Thank you.
yeah, they've applied for some one-time money through the Sparks panel. And we've been very supportive as a committee on the PACE program. Last year, we were instrumental, us and the legislature, in getting CASE put into caseloads. And you know, it's a great program, keeps folks out of nursing homes, lets them stay in their homes longer. It's just a great program, and anything we can do to encourage that is a good thing. Any further discussion? Seeing none, all in favor say aye.
Aye.
Opposed, same sign. Motion carries. Further recommendations. Representative Lynn, and by the way, Representative Lynn, welcome back.
Thank you. Thank you, Mr. Chair. It's good to be back. Okay. Oh, thank you very much. That was a lot of fun. Okay, I would like to recommend that we add 7.7 million, including 3.1 million SGF, and add language to increase reimbursement for the T1000 Medicaid code for specialized nursing care from $43 to $47 per hour for fiscal year 23.
Do you have a second? Representative Ruiz seconds it. I've had a rough time today talking. Start off like that. Discussion committee. Most of us are familiar with the T1000 or the special, I call it the T1000, everybody. It's a specialized nursing care code. And last year, the chair of this committee did not get the other folks on that when we got it through, and I've regretted it ever since. Well, the governor has in her budget already bringing the ID and the DD community up with the TA folks on that code, and then this just raises it further to $47. Matt, did we have a fiscal note on that just real quick? I thought we did. Yeah.
The fiscal note was the 7.7 million all funds.
All funds.
3.1 SGF.
So, okay, very good. Thank you. I have it somewhere in my pile of stuff here. Okay, very good, committee. Further discussion. Seeing none, all in favor say aye.
Aye.
Opposed, same sign. Motion carries. Okay, Representative Lynn.
I'd also like to recommend that we add 11.8 million, including 4.7 million SGF, to provide a 10% increase to increase the reimbursement rates for providers of HCBS frail elderly waiver services for fiscal year 23.
It was raise the frail and elderly waiver provider rates by 10%. Do I have a second? Representative Ruiz, you were seconding all of them. Okay, discussion on that committee. What I just found out, and I'm not sure there's very many people that know this, that the assisted living, folks, are not funded through the nursing home funding. So all the money that we put in here last year for nursing homes, none of it made it to the assisted living, folks, none. They have not had any assistance in that or during the pandemic or anything, increased prices. They are about 98% frail and elderly, and then they also serve PD, and they're paid on our waiver rates. You remember those charts that we have that have the 15-minute incrementals and all that off the waiver? They're paid by that. And then the housing, though, is paid by either Medicare or private pay or themselves. But they are paid just like our other providers. And their costs have just been going up through the roof. Got some stuff here. Their costs went up. Revenue, per day revenue, 2019, $85, 2021, $92. It's went up $7. And the cost of services in 2019 were $121, and in 2021 they were $140.76. So that is where that comes from. Further discussion? Seeing none, all in favor say aye.
Aye.
Opposed, same sign. Motion carries. Committee further. Representative Lynn.
Thank you, Mr. Chair. I'd also like to add $65.2 million, including $26.2 million SGF, to provide for a full rebase of the nursing facility daily Medicaid rate for fiscal year '23. This amount is the difference between the amount to fully rebase the daily rate and the 3% increase already included in the governor's recommendation for '23. This is based on the amount is based on calendar year 19, 20, and 21 cost data, as the data for calendar year 21 is an estimate.
Do I have a second? Second by Representative Helmer. Discussion. Committee, we have dealt with this for quite some time, the rebasing. This is the most accurate rebasing we have. The rebasing that we did last year was 17, 18, and 19. Because the way the process works, we are actually estimating 2021 right now because we do not get the true numbers back until after the budget is done. So that's why the caveat is in there that we're actually guesstimating. But, you know, in these periods of these high inflation like this, and you're doing you're actually 5 years out before, you know, and we all know what inflation's doing. Their costs are going up. So it's in statute that we do this. It's not in statute that we do it like we're doing it here, but that's what we're doing. So just, it's as accurate a picture as you're going to get about their actual costs. But it is in statute that we rebase every 3 years, but I'm not sure how many times it's been fulfilled in the time that I've been here, but not very many, if any. So anyway, further discussion. All in favor say aye.
Aye.
Opposed, same sign. Motion carries. Committee further recommendations. Representative Howerton.
Thank you, Mr. Chair. I'd like to recommend that we add $500,000 all SGF for Foster Adopt Connect to offer behavioral interventionist services for children with behavioral and emotional issues for FY 2023.
Very good. Do I have a second? Second by Representative Lynn. Discussion? I think we all heard the testimony from Foster Connect. Great way to get kids connected. They do a good job with that. And I think they can help us out. Okay, very good. Further discussion. All in favor say aye. Aye. Opposed, same sign. Motion carries. Further recommendations. Okay. I got to go to work here. Add language my recommendation is add language to allow the agency to establish guidelines for nursing facilities' request of waiver for staffing requirements compatible with CMS rules for 2023 and investigate similar guidelines for adult care homes in 2023. Do I have a second?
Second, Mr. Chairman.
Discussion? What, we've all heard about these staffing problems that our nursing homes are having and our facilities are having. CMS, the government, the federal government allows for nursing homes to apply for a waiver if they cannot provide that service. I've got too much paper. Well, I don't think you can help me. I'm pretty helpless. I just gathered that up.
While he's looking for that, remember I said that when we have to defend the budgets, we did, and we were there 4.5 hours Friday defending the budgets, and this morning, I think we were another 1.5 hours defending the budgets. They did not cut anything that we proposed. So, I mean, it was.
Not yet.
Not yet, but what I'm saying, it went through, so we'll wait until the big budget, but so far, so good, so. Just wanted y'all to know that since you made those recommendations, we're accountable to you too, okay?
Okay, here it is, committee. The Fed, this is 70414-1-2, waiver of nursing staffing requirements for nursing facilities. The requirements for long-term care facilities also requires that nursing facilities provide 24-hour licensed nursing, providing an RN for 8 hours a day, 8 consecutive hours a day, 7 days a week, and therefore that RN designated the director of nursing on a full-time basis. The state may waive these requirements if the following conditions are met. The facility demonstrates the satisfaction of the state that has made diligent efforts to recruit appropriate personnel. It is unable to do so. The state determines that the waiver will not endanger the health and safety of the residents of the facility, and the state finds that an RN or physician obligated to respond immediately to phone calls from the facility for periods when the licensed nursing services are not available. The state may grant a waiver from the 24-hour licensing requirement, the 8-hour consecutive hours a day, 7 days a week requirement, or both. The facility may be waived from the requirement to designate a director of nursing if it has been waived from either of the requirements to provide a 24-hour licensed nursing service or the 8-day consecutive hours a day or a 7-day-a-week requirement. If the waiver is granted, the state must provide notice of the waiver to the state long-term care ombudsman and the state protection advocacy system for the mentally ill and intellectually disabled. The facility granted the waiver must notify residents of the facility or responsible guardians and the members of the immediate family. That's just the start of it. What that is, that's the federal guideline. We do not have a state option to do that. And this recommendation removes that state option, or gives us the state option. It's in statute for a temporary period until next year. I think we've all heard about these staffing agencies and this kind of thing, and if we can give these folks an opportunity, I think that there are certain guidelines in there that don't. This is not going to affect people's safety, but this is actually going to help them not pay $400 an hour for nurses and stuff. So anyway, further discussion. Representative Reeves.
I agree with you. it's ridiculous, the hourly wages that are having to be put out right now. I mean, as long as there aren't going to be any safety issues. I think the other thing I would be concerned about, that they wouldn't, that nursing facilities wouldn't have an increase in using psychotropic medications on their residents as a way to kind of calm things down. Kansas is one of the states that has one of the highest uses of psychotropic medication. So that would be one of the safety concerns that I would have with this. But we have to address it in some way. This would be a good way to do it. Thank you.
And I certainly appreciate that concern. And, my concern with all of these is the safety of our citizens, and it's also having a place that cares for them that they can go to. So it's a fine line. But I will remind the committee that CMS this is not anything that CMS does not already allow. It's just that our state guidelines are stricter than that. So, Representative Ballard.
Thank you, Mr. Chairman. I would just comment along those lines because, the health advocates, Mitzi McPatrick, for years, talked about psychotropic drugs. And we had gotten to the point that we were feeling pretty comfortable that they were at a minimum. So again, I think we'd have to continue to monitor that to make sure, like you just said, they don't creep back up, because it's easier to have them sleeping than to be actively involved. Okay, so I didn't want to say it that way, but that's really what it really amounts to. So thank you, Mr.
And
Chairman.
I agree, and I think the department, we've seen the charts that our usage is going down, and I think they're monitoring that, very closely. I wouldn't want that to change. Committee, are there any more recommendations out there? I have one, another one. Delete $15 million SGF to remove the governor's recommendation for the 50 additional regional beds in 2023. Committee notes and understands the need to grow the capacity for the regional mental health beds. However, would like a report from ks during the 2023 session outlining current beds available in the strategic plan to staff these proposed beds prior to considering this item. Do I have a second? Thank you. Second by Representative Helmer. Oh, sorry. Okay. Yeah, sorry. Back up just a minute. Okay. Any more discussion on number 8, the language to establish guidelines for the nursing homes staffing requirement? Seeing none, all in favor say aye. Opposed, same sign. Okay. Now, sorry. Thank you for why we have here for me. Anyway, let me read my motion again. I would make a motion to delete $15 million SGF to remove the governor's recommendation for 50 additional regional beds for FY 2023. The committee notes and understands the need to grow the capacity for regional mental health beds. However, would like a report from ks during the 2023 session outlining the current beds available and the strategic plan to staff these proposed beds prior to consideration of this item. Do I have a second? Representative Helmer, discussion. We've been hearing a lot of talk about this new 50-bed facility. You've heard it with the department. And I'm not against it whatsoever. I'll say that. I think we need to go into this eyes wide open. We need a plan. We need a strategic plan. I don't even care about the location. But what if we build a new hospital and we can't staff that? We can't staff Larner. We can't staff any of our hospitals. And we have got to address those issues. And we also have to look at our beds going forward. What our needs are. What are Western Kansas needs? All that. It's a big picture issue. And I think we're going a little fast. Not against it at all. Just saying, hold on till the end of the session. I'd be happy to put it in during omnibus. see, I think we need a plan. We owe it to our taxpayers, we owe it to our citizens to have a concrete plan going forward, not just saying we're going to build a 50-bed facility. Representative Helmer.
Just to add to our thoughts, I just had someone in my office, and they can't staff schools with mental health workers. And mental health workers carry over into hospitals also. So, and I'm along that same thought. Where are we going to find these people? And I've talked to WSU, the coordinators that are working at WSU, and the numbers are low there. And if anybody's seen what Oklahoma State is doing, they're having a real hard time, and they've pretty much closed up what they're doing as far as education-wise, or they're thinking about it, is what's going on with it. Psychology, social work. So we're in a real danger area. Thank you for letting me speak. Thank you, Mr. Chairman.
Any further discussion? Representative Ballard.
Thank you. I'll comment on that further. We have heard that in appropriations. When I tell you we were there 4 and 5 hours, that's what part of that was. This morning, our discussion was along workforce, beds, staffing, whether or not we should build a new mental health facility, hospital other than, and not use Osawatomie. We went into all of this, but it all came down to we don't have enough staff. We have rooms, we have beds, we're ready to go. We have asked that Osawatomie be open, it is, but we can't open wings because we don't have enough people to staff them. So this is really a big problem. So again, I would say I'm not opposed to it by no means. I would be pushing it. But right now, we can't do what we need to do. So we need to halt a little bit until we can figure out how we're going to get some more people.
And what I'll tell you is this hospital is 5 years from being built. Anyway, just Sedgwick County has to get on board. Everybody has to get on board with this. So, Representative Ruiz.
Are these beds, did they come out of the recommendations of the mental health reform, modernization reform? And so they didn't do the research that we need right now?
Yes, but what he said, this is out 5 years. So when we were meeting, we would look at what we thought could happen in 2 years, what could happen in 4 years, what would take longer as we go along. So it was in many ways allowing for this, that's why it's for 5 years, because we don't know how we're progressing along. So it was discussed, but it also was thinking in terms of if we were going to reach the capacity of what we thought we needed with the increase in mental health and suicidal rates and everything else, this is something we should be looking at down the road.
And these were adult beds? We don't know that, yeah. That was part of your concern, because we don't know.
We don't know exactly what.
How many beds we actually have and whether they're kids and adults and so forth.
I'm not sure we know how many beds we need, period.
Yeah.
And I will tell you that the department has done good work, and I have supported the regional beds. This committee has supported the regional beds concept, and they've done a great job of spreading the beds around. It just makes sense. Travel time, all that kind of stuff. We talk about Western Kansas all the time. We need to get regional beds out there. We need things like that, and we just need to figure out what our needs are before we start on a new facility.
Thank you, Mr. Chair, for entertaining more questions. If the money, well, okay, I can understand why we ask for the money now, because it's a good time to ask for some funding right now, and we don't know what tomorrow's going to bring, or the next year is going to bring, or 2 years from now. So I can understand why the ask for the funding right now for those 50 beds, even though we don't, even though it could be 5 years down the road. I mean, things could change all of a sudden, and, maybe we can use it 2 years down the road rather than 5. So that's one of my hesitancy about this, is we have maybe the money now. We don't know if we're going to have it later when we find out, but like you said, that if we find out before omnibus, if we get that information, could be something that we could ask for later. Yeah. Thank you, Mr. Chair.
I don't think a couple of months or even a year is going to make one bit of difference in this. Representative Vaughn.
Thank you, Mr. Chair. I just wanted to clarify, was the 15 million the entire recommendation? I do wonder, even if they're not fully ready to implement the plan in its entirety, I imagine that they might need funds to begin the process of getting all of that done. So I wonder if it's worth leaving any amount in the budget, or if it is the will of the committee to take it all out. So I just posed that question. Thank you.
Yeah, good answer. I mean, good question. I don't know that this committee was briefed on that when it was in the budget. So I don't know what to tell you. It would be nice to know why they put it in there this year. I don't think it's part of the plan.
I would say, omnibus we don't get till until April. If we could get more information about how many beds, what the mix of beds might be, and everything else, it could still go into the mix for omnibus so that it wouldn't have to be a zero, or we could do what we thought was necessary. So I think just saying today doesn't close the door, It's either we take it out or they gonna take it out. Somebody's gonna take it out. I can tell you that already. And we've been lucky so far. But if you look at what we've come up with today, whew, you want to come and sit in the audience and cheer? Come on. Yeah, I think we're gonna have to deal with it eventually because our budget is getting higher and higher and higher.
Thank you, Mr. Chair. That was my thoughts in just thinking through this. I don't really understand the enormity of the KDADS program, but there were a lot of asks, and there are a lot of needs, and that are critical right this second, especially for the elderly and the disabled. And so if we can meet those needs and put this one off a little bit longer, maybe we can get it into a healthier position staffing-wise where we need it.
Thank you for that. Any further discussion about this? Okay, seeing none, all in favor say aye.
Aye.
Opposed, same sign. You want your votes recorded? Okay. Thank you. Motion passes. Did someone do one that says notes the committee's support for the $4.5 million for recruitment and retention of LPNs and RN proposal in the Sparksburg?
Chairman, I have that.
Thank you. Very good. You have a recommendation. Very good. I have a motion, a recommendation. Do I have a second? Second by Representative Reeves. Discussion? Again, committee, this is just weighing in on their asks. If there's any weight that this committee can, that we've taken a look at it and that we support it. Further discussion? All in favor say aye.
Aye.
Opposed, same sign. Motion carries. Well, I'll just make my motion first, then we'll do discussion. Okay, direct the agency to enter in agreements and enter in establishing rates for mobile competency evaluation and restoration with the CMHCs. Currently, do I have a second? Second by Representative Howerton. Currently, we have 6 CMHCs that do mobile competency. We've heard a lot about mobile competency and how we've got folks into jails, and this is before they come to Larned, whether they go to Larned or what happens to them. And this year there's money in the budget for a mobile competency deal where they go out to them, but they also have 6 CMHCs, and there's some guidelines for them to do that, but it costs money, and that's the rate factor that we're talking about here. And so to get off dead center in the mobile competency and getting these folks evaluated, I think we could look at our partners that they're the CMHCs and see if they're available or if they have the ability, because there are some guidelines there that are required for them to be able to do those evaluations. But I think that, well, we heard testimony, there's 163 folks sitting right now in county jails that have not been evaluated, and the sheriff or whoever in that jurisdiction is paying for those folks to be housed there. And this is just to try to help alleviate that situation. Now, in all honesty, we don't even know if we can get them into Larned because of the situation there. But if we can't get them evaluated, we certainly can't get them into Larned. So anyway, that's what this involves. So further discussion. Representative Howerton.
I want to thank you, Mr. Chair, for bringing that. We heard a lot about this in corrections and juvenile justice, that this is a real problem, especially in Sedgwick County where I'm from. There's a long wait list and they're just waiting to be assessed. So if we could figure out who needs to be assessed and what their needs are, that would go along with kind of hospital placement, because we don't know right now where they need to be.
Exactly.
Thank you for bringing that.
Any further discussion? All in favor say aye.
Aye.
Opposed, same sign. Motion carries. Committee, further recommendations. Sure. Right. And this says, would like a report from KDADS during, would like a report from KDADS during the 2023 session. That's before we get out of here. Outline current beds available and the strategic plan to staff these proposed beds prior to consideration of this item. You're good. I mean, committee, don't be afraid to ask questions and clarify things at all, any of you. Okay, any further recommendations? Okay, seeing none, that concludes our KDAD's recommendations. Do we have anything else to do? Oh, we do. Do we have to do all of them? Okay. I would move to pass the Department of Aging and Disabilities budget for the 2022 and 23 session. Let's see, as the governor's recs with the following, with the budget recommendations. Is that butcher it pretty good, or is it good enough? You guys are good wordsmithers, so anyway, that's my motion. Second by Representative Ballard. Discussion? All in favor, say aye.
Aye.
Opposed, same sign. Motion carries. Well, committee, thank you for your work this year. We may have some informational meetings from time to time, depending on whether you guys want to, because I don't want to sit in here, but by myself. But thank you very much. My door is always open for clarification on these issues. It's a big ship, and I know enough to be dangerous is all I can say. So with that, we're adjourned.